tell you it's my opinion, okay? But that's a fact. That's information that you can find. Do some research.
And doesn't the myelin sheath also have the good fats to help do the firing of the muscles?
Exactly. So the question is not then the nerve cell body. Think about this. In your spine, okay, your spinal cord ends at the level of your belly button. That means all of the nerve cell bodies are right there at the level of your belly button in your spinal cord. That means one cell is the whole length of your leg. So think about these guys that are 7 feet tall with 5 foot long legs. That's one cell going all the way down to their leg, to their foot. Okay? That means that every gap, in order for them to communicate along that process, it's called saltatory conduction. Okay? What's salta in Spanish? Did anybody take that? Jump. Or Latin?
Jump.
To jump, right? Salta. And what this is called saltatory conduction. Instead of just motoring all the way down that nerve, the body gives impulses, and these myelin sheaths that you're referring to wrap this, and then what it does, it causes the nerve impulse to jump, 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 so it actually can get there faster. Okay? Demyelination diseases, peripheral neuropathies, use of statin drugs, there are so many things that we look at that cause demyelination. One of them can be a genetic defect, Charcot-Marie-Tooth syndrome, CMT. It happens, it's common, and especially in these valleys here where you're Danish and you're Welsh and you're Irish and you're European descent, very, very common genetic peripheral palsy. Okay, you'll see hammer toes in it very commonly. You'll see a steppage or a lifting gait. You'll see that they'll have a drawing primarily in the feet first. And it's slow to be diagnosed, but you'll see a little bit of discoordination in the child. We look at MS, we look at amyotrophic lateral sclerosis. All of these have to do with this conduction and demyelination presentations. Okay? Can be associated, yes, with a virus, but often it's an autoimmunity caused by, again, gluten. Yeah, I know we talk about this a lot, but it's very, very common. Okay? So, yes, saltatory conduction and to jump, when that's demyelinated, when that fat, those good fats are gone, it can't be rebuilt. Now, here's the amazing thing. Did you know that the trans fats, and I won't give any labeled brands, but in your kids' favorite peanut butters, okay? Those trans fats, if it can sit on the shelf for more than 2 weeks, more than really 7 days, it has trans fats in it. There's something there that's preserving it, and that's what's preserving it.
And that's the bad fat.
That's the bad fat. Because it's more readily absorbed through your liver and goes out and replaces the fats in your cells. So we're actually preserving our bodies, but not to live. They already have embalming fluids. Why are we trying to embalm ourselves while we're alive? But that's what we're doing, right? And if you look at our health, that's where our people are going.
So what are good fats then?
Avocados are excellent fats, okay? Coconut oil, olive oil, those are excellent fats. Okay? So good question. Very good question. Let me just comment then one more time. Why do I still feel a need for sugar after I've eaten? Okay? The longer that you have cortisol released, your body becomes or acts more and more in a stress response. And that hypoglycemia can actually lead to elevated prolactin. Prolactin becomes a stress hormone when not lactating. What's lactation? Nursing, okay? Milk production. When you are not producing though, and this is where we've had some women come to us who haven't had a child in years or have never had a child, and they say it can actually express milk. How can that be? This is a stress hormone, okay? Prolactin in the female cycle inhibits progesterone from being released. So I'll just put progesterone from being released. Why? Because it cannot allow then for a luteinizing hormone to be released. Okay? So it never allows this. Prolactin inhibits luteinizing hormone, so now I have no progesterone in my cycle. My cycle gets further and further and further delayed, and now I become more and more infertile, and I become more and more estrogen dominant. So hypoglycemia is actually estrogen dominance, which is then infertility. Right? Does that make sense? Isn't that crazy how these cycles just keep overlapping?
Yeah, something like that cause a woman to go into menopause early.
Correct. So the next question is then, as we lengthen and lengthen and lengthen and lengthen out our cycle, a period missed for a year is menopause. And this is where we see then the 30-year-old, the 32-year-old who's missing periods, who's actually, yeah, I haven't had a period for 3 months. Oh, yeah, I haven't had a period for 6 months. Well, yeah, you didn't want to get pregnant. Ode to joy. Wonderful, right? Not really. That means your system is whacked. It's not functioning. It's lost its sensitivity. And this is starting to become then your presentation where there's complete endocrine confusion. And so what do I need? More and more sugar and more caffeine to keep me going. And what am I doing? Pushing my body further and further into the tank.
So again, I think you just said, but prolactin is caused by too much cortisol, or
Elevated cortisol
yeah.
causes an elevation of prolactin, which becomes then a stress hormone.
And cortisol, too much cortisol is only if your adrenals are hyper-functioning, or can it happen hypo?
The question then is, can elevations of cortisol happen in hyperfunctioning or hyperadrenia or hypofunctioning adrenia? And the answer is yes. Okay? This is why. Cortisol, again, to maintain blood sugar for the brain during a fasting state. So, no, I never eat breakfast. Why would I eat breakfast? I don't feel well when morning comes. Breakfast makes me nauseous. If I eat in the morning, I feel nauseated. Okay? That means your cortisol burden is elevated. Okay? But what happens after your adrenals can no longer respond? You no longer get cortisol from your adrenals. Now what happens is, in the hormonal cascade, so this is something that is just a great question, but is really, we'll go advanced endocrinology just for a moment, okay? But let's just keep it as simple and as advanced as we can. Cholesterol is the precursor to all hormones. Let me say that one more time. Cholesterol is essential to all hormone function. Let me say that another way. For men who are on a statin drug, the most common immediate side effect is erectile dysfunction, because they just push their testosterone levels completely into the ground. They're gone. Okay? Because cholesterol is the precursor to all hormones. Is that clear? Cholesterol then breaks down into a parent hormone, which is called pregnenolone. And pregnenolone then breaks down into all of our essential hormones. It breaks down into estrogen. It breaks down into progesterone. It breaks down into testosterone, DHEA, androstenedione, and so on. Okay? All of these come from parent, and offspring, if you will. Okay? But what happens when our cortisol levels are no longer naturally being produced by the adrenals? The body will actually start to do what's called a pregnenolone steal, and it will steal from all these hormones to make cortisol, to be able to make sugar in a fasting state, to be able to feed the brain. So when you ask again, what's the most important metabolic function? According to the body, preferentially, it's to maintain sugar to feed the brain. Okay? The brain will do everything. Every system below in the hierarchy is subservient to feeding the brain. That's